to Her Comeback, Transforming Your Life After 50. I'm your host, Michelle Thompson. If you've ever whispered to yourself, there has to be more than this, you are in the right place. This show is for women over 50 who have hit their breaking point and are finally ready to stop going at it alone. You've tried the self-help books, the vision boards, the positive thinking, but you're still stuck. And here's what I know. You're not broken. You just need the right support. And that's exactly what you're going to find here. Each week, I'll sit down with incredible women who have transformed their lives. You'll hear their real stories, the messy middle, the breakthrough moments, the practical steps that they took to create the lives that they love. Because your lowest moment, it can be your launching pad. So if you're done settling and ready for your comeback, stay with me. Let's discover how other women have made it happen and how you can too. Are you ready? This is Her Comeback. Good day, everyone. I am so excited about today's episode. I have Dr. Lorna Fedelem joining us. Welcome, Dr. Lorna. Is it okay to call you Dr. Lorna, or what do you
Yes,
prefer?
absolutely. Hi, Michelle.
It's so good to see you. I was so fortunate to have met you early on, right after I moved to Florida. You helped me tremendously navigate some of my own health issues that I talk about in my transformation. And so it's just a pleasure to have you on my show. Why don't you tell our audience a little bit about yourself?
Sure. So I was born and raised in Naples, Florida. So I'm one of those rare ones who grew up here. So my family's always been here. And when I graduated from Barron Collier, I went to Florida State, went there for undergrad and completed my medical school training there and residency. So I'm pretty much a Florida girl through and through. Practiced hospital medicine for 10 years in Tallahassee and 3 years in Orlando. And then 5 years ago, moved back to Naples in the middle of COVID. I decided that I really wanted to have more of an impact on my patients in a proactive way. And so that was why I decided to go into private practice instead of going back into the hospital so that I could have those long term relationships and really feel like I was making changes for people that were interested in hearing what I had to say versus in the hospital where cat's already out of the bag, so to speak.
Yeah, right.
Yeah,
And,
so
and,
here
and
I
that,
am.
yes, great. So I guess working more on the preventative side, right?
Yeah, absolutely.
Yeah. So, what would you say in your practice, probably the most common health issue you see women dismissing or normalizing that are in their 50s, but it's actually they should give that attention? Is there something that you would call attention to?
Yeah, absolutely. So, through my practice and the membership medicine model, I allow 2 hours for my intake with my new patients on the primary care side. And so, by having the time to talk with women and really ask those challenging questions, I would say the top two things that I find women tend to think, I just have to live with this as normal, is number one, the pelvic floor and the cough, sneeze, leaking a little bit of urine, because there's definitely things we can do about that. You don't have to live with that. And then the other thing that's even harder to talk about is just intimacy. A lot of women, their relationships have suffered because maybe it hurts or it doesn't. I'm not interested anymore, or that's the one part of my relationship that isn't what it used to be. And we don't have to just suffer through that either. So I definitely have those difficult conversations because there's things that we can do to make it better.
Oh, that's awesome. And are your patients generally receptive to that and they're willing to maybe open up a little bit more and have some of those conversations?
Yeah, absolutely. A lot of my female patients come to me because I am a woman. I want to have an inviting environment for them here. I want them to feel comfortable and welcomed. And many times I hear from my patients, nobody has ever asked me that before. Or I'll hear, I've never told any of my doctors that before, but I feel comfortable with you and I'm okay with having that conversation because it gets swept under the rug or it just gets ignored completely. When a provider maybe only has 15 or 20 minutes, they're going to address the more urgent issues, but I want to take the time to address men and women from head to toe, and intimacy and bladder issues are important. If
Yes.
anything, they're more important than some other things because it has such a negative impact on your life.
Right. The quality of life. Right.
For
Yes,
sure.
absolutely. Um, how does the approach to preventative care and wellness need to shift as we go into our 50s? Like maybe things that used to work when we were 30,
Hmm.
40, maybe doesn't work anymore. Can you
Yeah.
speak to that?
Yeah, absolutely. Things definitely shift. Women go through a much more dramatic change than men do. And so we have to take care of ourselves. And it's important from both a medical and a mental health standpoint. But medically speaking, our risks go up as we age and as we go from our 40s to our 50s. We have an increased risk of cardiovascular disease. We naturally have an increased risk of breast cancer. Hormones are changing and fluctuating, which has an impact on your quality of sleep, an impact on your clarity of thought, and all of those things are all intertwined. And so you have to have a provider that understands all the nuances of how just simply entering into your 50s plays into your health. And it is truly from head to toe.
What do you wish more women knew about hormone changes beyond just menopause symptoms? What would
Yeah,
you say?
I mentioned a little bit our cardiovascular risks go up. So as we lose our estrogen, we're actually at risk to have high cholesterol when that was never a problem in our 20s, 30s and 40s. And all of a sudden women think they're doing something wrong when they're really not. That is a byproduct of hormonal changes, just like changes in endocrine issues like hypothyroidism or hyperthyroidism, or how we process sugars or prediabetes, weight gain, weight changes, fat distribution fluctuations, and all of these things. It's not just the hormones, but sometimes correcting the hormonal issues will help with some of those other issues as well. But I think it's a much more diverse overall body change than I feel like anybody ever talks about. That's what I find in my practice. And so that's why those conversations, and sometimes I don't even get through everything in 2 hours. And you know what? We can get through right now. And let's have you come back next week. Let's make some changes and continue the conversation. And I can do that in my practice. So that just helps me take better care.
Yeah. I know from my own experience when I started having a lot of symptoms of menopause or perimenopause or whatever, it was just a full on, it felt like an assault because I couldn't sleep. I was anxious. I was losing my hair. Like
Mhm.
down the checklist. And when we had talked and you suggested doing some hormone replacement therapy, for me, it was like a no brainer. I was like, I'm going to do anything to live
Mhm.
better because it was just such a terrible quality of life. In talking with other women, I think particularly maybe women that are a little bit older than me, I still hear a lot of resistance to the hormone replacement therapy.
Yeah.
Oh, estrogen causes cancer, or that kind of thing. What do you say to women that maybe still have those notions?
Sure. When you and I first met, the data that's available now did not exist. There has been some new research. And even with the new research, the original research that was done back in the 90s was done on the wrong set of women at the wrong dose of estrogen. And so, therefore, the conclusions were really not even applicable to women in their 40s, 50s, going through perimenopause and menopause. And so, luckily, the research was redone on the proper population with the proper dosing of estrogen. And lo and behold, some arms of the study actually showed that the women on hormones had a lower risk of breast cancer. So a lot of women don't realize that if we get stuck in the old information and just this mindset that was driven into us in our 90s. My mother went through that. She was on hormones and it was just pull the rug out, can't be on it anymore. It's not safe. And it's just perpetuated. And so in medicine, trying to change that trajectory is really, really hard. And I'm sure that everybody knows a woman who was on hormones that got breast cancer, but it doesn't mean that the hormones caused that breast cancer. She probably would have gotten that breast cancer whether she was on hormones or not. You have to kind of take a step back, take a deep breath. Lowest effective dose. We're not talking about massive, huge amounts of estrogen. Small doses are beneficial. And even the newest information, which was released during the Menopause Society meeting just a week or two ago, is now they're actually thinking that women who are started on hormone replacement within 10 years of going through menopause have a 60% lower risk of getting breast cancer, and that
Wow,
is like huge. Now it
definitely.
doesn't that doesn't just release everybody a blanket, all women get hormones. You still need to process that information, do risk assessments, which I do on every single one of my patients, and make sure that you are a good candidate for it. Family history comes into play, etc. But it's really encouraging to hear those kind of studies exist, and that it's most likely going to prompt more research to really dive into what that means for us.
That's terrific. That's really good to hear.
Hmm.
Um, in your practice, what difference do you see in outcomes for women that are very active in the partnership with their role and their health with you versus those that are maybe more passive? What things do you see?
Well, so the thing is, in my practice, because I take on a limited number of patients, and that's what allows me to have the time to commit, I honestly can say I don't have any women who don't participate. So I am blessed to have a patient population that when they come to me, they are invested in their health and they want to be better and feel better. And I always call myself an educator because it's all about me explaining what I know. This is the research. This is my experience. These are my recommendations. I'm educating you. And then the decision is yours. My patients don't have to follow my recommendations. The majority of them do. But I do still have women that are hesitant to do hormone replacement, even though it would be a safe choice for them. And I'm okay with that. I just want them to understand that this probably would give you the best results, but we have additional things that we can try that are non hormonal. And so it's all about having that arsenal that I can pull from of it doesn't have to be hormone replacement, and not everybody is a good candidate. But my women, they're invested and they participate, and it's really refreshing.
So, for people in our audience, maybe there's some women out there that have taken that more passive approach. Are there any words of encouragement that you would offer to them?
When I see my women come in just in a state, I haven't slept in 2 weeks. I can't think straight. I have brain fog. I have hot flashes. I sweat at the drop of a hat. And we talk, and I start them on some low dose estrogen and progesterone. They're a good candidate. And they come back and see me within a week or two. I finally slept and I feel amazing. And that is why I do what I do. And so I try to explain to my women that are maybe a little bit more hesitant, look, I've done this with many women and I'm here with you. We're going to get through this. And so sometimes it does take a little bit longer for women to be open to the idea of trying a hormone replacement. And we may go through some other options. There's some off label uses of other medications. I have a few devices that can help with vaginal dryness and the pelvic floor and those types of things. The vast majority will eventually come around and at least give it a try. And the majority of the time, glad that they did.
That's wonderful. Are there any foundational health practices or screenings that you would recommend that can give women energy, longevity to fully live life in this life after 50?
Sure.
What are the things there that you recommend?
So my big four that I talk about with every single one of my patients, pelvic exams. So pap tests are recommended every 3 to 5 years. It's a screening test, it's quick, it's easy, and it's effective. We don't want to ignore that side of our health because cells can change and cancers can happen, and but they're easy to fix. So we want to stay on top of that. Surely the annual mammogram is huge because Personally, in my practice, I had one woman who went 2 years and a little cancer popped up. It was just, oh my gosh, all because she skipped a year, and it really hits home. She's okay, we got it. She went through lumpectomy and radiation, and she's going to be fine. But mammo's hugely helpful and effective. DEXA scans really a little bit more past 50, but more like 60, 65, so paying attention to our bones. And the colonoscopies, I did my first one at 48. It kind of gets a bad rap, but to be honest, it really wasn't that bad. These are all tools that we have that are tried and true. And if we can, at a minimum, do these basics, follow lab work, hydrate, and then, like I said earlier, the hormones sooner than later, you're gonna be off to a good start.
Awesome. Thank you for all of those thoughts and recommendations. What would you like our audience to know about you?
I love what I do. If there's anything that I would want your listeners and viewers to know, is that I really do truly love what I do. I went into medicine to practice primary care, because I enjoy the relationships that I get to build with my patients. And my patients, they feel like family. And so I love what I do. My practice has morphed into not just the concierge medicine side, but I also have a wellness center. And memberships are not required for the wellness center, but I have some really incredible equipment in there too. The ExoMind for mental clarity, the Chair for the pelvic floor, the Sculpt is really for core strength, and then we do a couple of other fun things with the Face for, little refresh on your face and skin, and some microneedling. I didn't necessarily set out to have the wellness side of my practice, but I really do love that too. It's been an absolute joy to be back in Naples. It's just, this is where I belong. I 100% know that this is where I belong. These are my people. This is my place. I love Naples. I love the beach, all of that. I have two boys. I have a 12 and 14-year-old boys. My older son is on the spectrum. I completely and 100% understand special needs. So, yeah, that's me.
Oh, wonderful. I am so glad you're in Naples too, for one.
Thank
I tell
you.
you, and I love it here too. It's a great place to be. Is there any particular promotions or anything else you want the audience to know about with your practice or your business?
Yeah, actually, we are doing a winter wellness event on December 10th. It's on a Wednesday from 1 to 4. And we're going to be showcasing our 4 no downtime devices. So, our little head to toe, no downtime wellness event. So, if anyone is interested, they can call the office. The number is 239 580 6390. And Melissa is my receptionist. We'd like to have a head count ahead of time, but it's not necessary. So I would absolutely love it for your ladies to stop by, check out the equipment, see what it's all about, learn about that, learn about concierge medicine, just all those really great things. I love my office. You've been here. I love the environment. My sister's a designer, and she helped me pick out the colors and the designs. And I think it's very welcoming and comfortable. So I love for people to come and see it, because I think that makes a difference too.
Absolutely. And it is. It's beautiful. It's a beautiful place. What's the best way for people to contact you then?
So the probably calling the office is the easiest.
Okay.
That's the 239 580 6390. We can also email if that works too. Melissa is front desk at lornafedelemmd.com. And my website too is lornafedelemmd.com. There's a lot of information on there about the different devices that we have, and there's a contact form in there too. So you can always go to the website and fill out that I'm interested as well. But probably calling, it's nice because we answer the phone. So sometimes it's hard to get a human being on the other line. so,
Absolutely. So it is
so,
very refreshing to be able to
yeah.
call and get somebody, a human on the phone to
Yes.
speak to. That's awesome. Wonderful.
Yeah.
Thank you so much for joining me today. I think our audience will just get a lot from the information shared and your thoughts here. I wish you all of the best as you open and rebrand with your wellness center and everything that you're doing in this area here. I wish you all the best.
Well, thank you. And I appreciate what you're doing too. So I'm super proud of you for following your passion
Thank
and
you.
reaching out and really having the outreach for women as we go through that perimenopause and menopause, because God knows we all need to help each other. So
Yes,
I'm glad that you
absolutely.
do what you do.
That's right. Connection and support are
For
key. That
sure.
is the truth. All right. Well, thank you again, and I hope you have a wonderful rest of your day and weekend.
Thank you. You too.
All right. Thank you so much for spending time with me today. I am truly grateful that you chose to listen in, and I hope that this conversation sparks something meaningful for you. Please take a moment to subscribe, leave a review. It helps other women to find us who need to hear these stories too. And if you know someone who is ready for their own comeback, share this episode with them. I'd love to connect with you beyond the podcast. Visit me at hercomebackpodcast.com. That's hercomebackpodcast.com to learn more about how we can work together. I have a gift for you. Get your free copy today of 5 powerful shifts to reclaim your life. Remember, your comeback story is waiting to be written. The question isn't, can I transform my life? The question is, are you ready? Let's go. I cross my legs up in my tongue.